I am Shanmugapriya, lecturer in SNS College of Allied Health Science. Today we are going to discuss a topic on electroencephalogram. So, electroencephalogram, that is, we usually call it as EEG. It records electrical activity of brain. During EEG test, small electrodes like cup or disc type are placed on the scalp. They pick up the brain's electric signals and send them to the machine called encephalogram. It records the signals as very lines on the computer screens or paper in order to microvolt. History: in 1875, Richard Caton, physician from Germany, discovered electrical activity of brain of animals, rabbit and monkey. In 1890, Adolf Beck, psychologist of Portland, investigation of spontaneous electrical activity of brain of rabbits and dogs. In 1920, Hans Berger, Austrian psychiatrist, was the first to record EEG tracings from human beings using alpha waves. In 1935, Froster and Alterberger, they were first used intraoperative EEG. In 1950, Herbert Jasper and Wilder Penfield developed this technique using ECOG for localization and surgical treatment of epilepsy. Why is it done? EEG is used to diagnose brain disorders by detecting changes in brain activity. Example: epilepsy or seizure, brain damage, brain tumor, brain dysfunction, brain death. It is used to investigate other conditions such as brain injury, dementia, mental activity, and hemorrhage. To determine the level of brain function in people who are in coma. Identify areas of brain that are not working properly. Client preparation before procedure. Explain purpose and procedure of to the patient. The procedure is safe and painless. It do not give shock. It is done by trained persons. The patient should come with hair wash and then do not use any over hairs like hair oil or conditioner, etc. Because oil can alter conduction of electric activity. Do not take stimulants like coffee, tea, beverages, caffeine, antidepressant tablets, anti-seizure medications for 24 to 48 hours before test because they may alter the brain activity. Post procedure: wash or clean patient's hair, maintain safety precaution if the patient was sedated. Procedure: a standard non-invasive EEG takes about 1 hour. The patient will be positioned on a padded bed or table or in comfortable chair. To maintain or ensure electrical activity in various parts of brain, a nurse or EEG technician will attach electrodes to the scalp. The brain generates electrical impulses that these electrodes will pick up. Then a temporary glue will be used to attach them to the skin. Types of lobes: frontal lobe, emotional and motor control; parietal lobe, sensory purpose pain, touch pressure. Temporal lobe is the auditory system. Occipital lobe, visual purpose. Types of wave: alpha 18 to 12 Hz, beta 13 to 35 Hz, delta 0 to 3 Hz, theta 4 to 7, gamma 35 to 100. Alpha waves. Alpha waves are found in person resting state. When they are awake or closed eyes, it disappears during sleep. They occur in partial and occipital lobes. Frequency is about 8 to 12 Hz per second. Amplitude is 50 to 100. Alpha rhythm is abolished with brain activity or by visual stimuli, opening of eyes. This is also called as alpha block and also altering responses. In the next section, we will